Welcome to another study group RN section. This is Nurse Mia. Today we cover chapter 5, Palliative Care, End of Life Care. And if you like the way I study, you can download the PDF down below in the description. This is part 3 from chapter 5, Palliative Care and End of Life Issues, NCLEX-style exam questions. Question number 1, select all that apply. We love that. SATA. Which of the following interventions are appropriate for a nurse providing palliative care to a patient with end-stage heart failure? A. Treat opioids to relieve dyspnea. B. Initiate CPR if pulse is lost. Encourage family presence at bedside. D. Perform spiritual assessment. E. Administer chemotherapy to shrink the tumor. So you select all of the apply. What interventions are appropriate for a nurse to provide palliative care for end-stage heart failure? So it's palliative, it's not hospice. Treat opioids to relieve dyspnea. Encourage family presence at bedside. Perform spiritual assessment. So the correct answer, they were A, C, and D. So the A, symptom control, it's a key for palliative goal. The C, emotional support and presence are part of holistic care. B, spiritual needs are central to palliative care. So the incorrect one, they were B, CPR, won't contradict many palliative/hospice care goals. And E, chemotherapy is curative, not palliative in this context. Question 2, here we have a priority setting, clinical judgment. A patient with metastatic cancer tells the nurse, "I'm scared to die and don't want to suffer." Which is the nurse's priority response? A. Would you like to speak with a chaplain? B. Tell me more about what are you afraid of? C. Let's review your advance directive. D. Would you like something to help you sleep? So the correct answer is, tell me more about what are you afraid of? Is the priority response. When the patient says, I am scared to die, so the priority response is, tell me more, what are you afraid of? Question 3, case-based. A 76-year-old patient with advanced COPD is receiving hospice care at home. The family expressed concern about noisy, irregular breathing patterns. What should the nurse do? A. Call 911. B. Explain the Chickstone's respiration are expected. C. Increase oxygen flow rate. D. Encourage oral fluid intake. So COPD patient receiving hospice care at home. Family expresses concern about noisy, irregular breathing. So the correct answer is explain the respirations are expected within receiving hospice care at home. Question 4. Again, SATA. Which are components of effective post-mortem care? A. Remove medical equipment and tubes. B. Notify the family and support their cultural needs. C. Document time of death and interventions. D. Begin CPR immediately. D. E. Prepare body for viewing or transport. So it's removing medical equipment and tubes. Notify the family and support their cultural needs. Document time of death and interventions. Prepare the body for viewing or transport. It should not be CPR. It's already post-mortem care. Question 5. It's ethical practice. A nurse caring for a terminal ill patient knows the patient would not want resuscitation. The family insists on doing everything. What should a nurse do first? So the correct answers, well, here is multiple answer. A, call the ethics community, review the advance directive and contact the provider, begin CPR per family request, contact hospital legal team. Correct answer is review the advance directive and contact the provider. Again, select all the apply question, ethical and legal aspects. Which actions should the nurse take when caring for a competent patient who has a completed advance directive that the family disagree with? A. Honor the patient's documented preferences. Involve the ethics community to override the directive. Inform the healthcare provider of the directive. D. Encourage family to voice concern but explain the patient rights. E. Delay care until the family reaches consensus. Correct answer are, so select all the apply. Honor the patient documented preferences. Inform the healthcare provider of the directive. Encourage family to voice concerns but explain the patient rights. 7. Multiple choice. Psychosocial care. A dying patient family express that they are already grieving the loss even though the patient is still alive. What is the nurse's best interpretation of this behavior? Denial, complicated grief, caregiver burden, anticipatory grief. So it's psychosocial care. Correct answer is anticipatory grief. 8. Prioritization, which is symptom management. An older adult with terminal cancer is expressing audible gurgling respiration and appears breathless. What should the nurse do first? A. Respiration the patient laterally. Reposition the patient laterally with the head elevated. B. Request an immediate spiritual consult. C. Administer IV morphine. D. Suction the airway deeply. Symptom management. Terminal cancer has audible gurgling respiration and appears restless. What should the nurse do first? Correct answer is reposition the patient laterally with the head elevated. You do first. 9. Multiple choice pediatric palliative care. A child with a terminal illness is no longer eating and has stopped responding to parents. Which action best supports family-centered end-of-life care? So it's no longer eating and stop responding to the parents. A. Reassure the family this is part of dying process. B. Call for psychiatric evaluation. Encourage force feeding to prevent discomfort. D. Advise the family to limit time at the bedside. Correct answer is A. Reassure the family this is part of the dying process. The last question, 10. SATA, select of all of the apply imminent death signs. Which findings in a patient with advanced illness indicate that death is approaching within hours to days? A. Irregular shallow respirations. B. Dry motor skin on extremities. C. Increased verbal communication. D. Decreased responsiveness. E. Elevated blood pressure and pulse. Correct answer are irregular shallow respirations, dry motor skin on extremities, and decreased responsiveness. That's it. These are the 10 practice NCLEX questions for this chapter 5. And this is the end of the chapter. Thanks for watching. I hope it was helpful. Like and subscribe for future chapters. Comment if you like the PDF and if the PDF was helpful, or if you have any other opinions. Bye for now.